In America, someone is diagnosed with diabetes every 17 seconds, and more than 37 million are suffering from this chronic disease.
There's two types of diabetes. Type 1 diabetes is when there's autoimmune destruction of the pancreatic beta cells. These are the beta cells of the pancreas that actually produce insulin. So your body actually doesn't produce insulin. So you need to get injections of insulin because you don't have any insulin. That actually only accounts to about 5% of all the diabetes that's out there. 95% of all the diabetes that's out there is actually type 2 diabetes. In type 2 diabetes, your body produces plenty of insulin, but over time, because of high levels of blood sugar from eating a number of processed foods or foods that have simple sugars without enough fiber, you basically get resistance to insulin.
Dr. Marvasti says think of insulin resistance like the shock absorbers on your car.
When we keep hitting with these high blood sugar levels, high insulin levels back and forth over and over again, the resistance happens and basically your shock absorbers get shot and you're no longer able to lower your blood sugar levels. And from that comes all sorts of complications.
According to the CDC, there are about 96 million people in the U.S. who are pre-diabetic, and many of them are undiagnosed.
Which is why it's so important to know your numbers. It's very simple to do a simple blood sugar test. Ask your doctor for this test. One test is to do a fasting blood sugar. And so basically you'll be fasting for at least 8 hours or 10 hours optimally, greater than 126 or greater fasting, then you're in the diabetes range. And then the other one is to look at your hemoglobin A1C, which is basically a calculation of the average blood sugar that you have over the course of 3 months. There's a pre-diabetic range and then there's a diabetes range, so you can also check that. Both of these labs can be available and covered by most insurance.
Knowing your numbers and the symptoms of diabetes can help you get ahead of this disease. The Mayo Clinic says symptoms may include increased thirst, frequent urination, increased hunger, unintended weight loss, fatigue, and blurred vision. And uncontrolled blood sugar levels can lead to complications.
Not controlling a blood sugar can have a number of different consequences and cause inflammation, which increases the risk of narrowing of your arteries, atherosclerosis, leading to increased risk for heart disease, heart attacks, and strokes. They can also get caught in the small blood vessels that feed your eyes, which is why diabetes is the leading cause of non-congenital blindness. Diabetes is also the #1 cause of kidney failure, and they can also cause lower limb diseases because of poor circulation.
But the good news is you can change your outcome by simply changing your diet and lifestyle.
The best advice to stay healthy is to work on your diet, #1, because 70% of our diet is unfortunately these frankenfoods, processed foods. So start by eating real food, eating whole grains, eating healthy fat, and avoiding simple carbs and simple sugars. Beginning to be physically active as well, because that also helps us with maintaining optimal weight and lowering our blood sugar levels. So I really think that if you can make those changes, and if you can hang on for at least 3 weeks, about the same period of time that it takes for your taste buds to change over, then you're going to get accustomed to the new diet and your blood sugar will come down. So I think, this is a really good case in point of how food can be used as medicine.